Okay, everybody, just want to quickly run you through Chapter 7 before the exam on Monday. This chapter deals with cultural conceptions of health and illness. And so we started this chapter today by talking about whether we had kind of similar ways based on our cultural upbringings of how we cure hiccups. And while some of the differences we found in class today probably weren't a product of our different cultures, we do have old wives' tales that our families have kind of always held about different ways to approach illness. So, for example, I gave the example of my crazy Italian grandma who, if you have a wart, you're supposed to rub a potato on it and bury it in the backyard. And so, a lot of our approaches to health are a product of our culture. And so, culture is defined as a set of beliefs, rules, and practices that are shared by a group of people. And culture also suggests how the people within this culture should behave, the roles they're expected to play, and how we should interpret different events and actions in our lives. And so, obviously, culture can affect what people consider acceptable, admirable, and shameful regarding health. We've talked a lot about what our culture in particular views as shameful related to health. Even things that we might consider to be healthy. And so, remember the Fiji article we read about how being overweight, slightly overweight, is considered healthy in that culture, right? And so, especially if you've ever experienced healthcare in a different culture or in a different country, thinking about how it was similar or different from home might be really illuminating to think about how the overall culture approaches health. And so, if any of you guys have ever had any experiences overseas in a different hospital or seeing a doctor or something, I'd love to hear about it. But this quote, I think, is really illuminating about what culture means and how its relationship to illness. And language is defined by, reflects, and transmits culture. So, meaning that our perceptions of health are so embedded in our culture, we probably rarely stop to think about them. And we can't really figure out what our culture, how our culture approaches health until we actually talk about it and learn about it from other people. And we compare it to other cultures. And so, for example, there's this really good case study called The Scalpel and the Silver Bear, which is about the first Navajo female surgeon, Navajo American Indian tribe. And so the Navajo tribe don't like to discuss the possibility of, negative outcomes related to surgery or something, because by talking about them, you're just kind of speaking them into existence. So basically, to talk about something that could possibly bad that happens with surgery, you're allowing it to happen. And so, this is something that the author talks a lot about, a challenge of her practice, in addition to being the first female surgeon in this kind of male-dominated culture. And so, chapter 6, we talked a lot about how people who are really similar to one another are more likely to understand each other better and achieve shared meaning easier. And shared meaning, obviously, a huge piece of communication so far in this class. But we unfortunately run into a lot of ethnocentrism related to culture, which is this conviction that what's familiar to us is more right or more moral than whatever alternatives are out there, what other cultures approach certain things. So one person's culture is better than others, or we don't even really consider that there's an alternative to the way that we approach things. And so, unfortunately, this kind of others people from different cultures, which basically means you're treating them like they don't belong. And in medical interactions or medical transactions, this is really demoralizing to patients, especially. And so it's really tempting for us to stereotype what's unfamiliar to us. And the stereotyping, as we talked about in chapter 6, especially with minority patients, can really affect the treatment decisions we make and the advice we give them, and can lead to strained relationships and misunderstandings. And so I took a webinar over Christmas break that talked a little bit about how patients can, providers can talk a little bit more with very diverse patients. And so to be effective at intercultural communication as a healthcare worker, and this is also true if you ever do business overseas or travel overseas, the first thing to keep in mind is that knowledge about the culture is not enough by itself, right? Because it's impossible to know the ins and outs of every culture that you would come in contact with. You can't do it. You cannot predict which cultures you'd be exposed to every day as a healthcare provider, right? And so what you have to do is be introspective and be interested in other people. You have to embrace the ambiguity, meaning be okay with observing and asking questions, being okay with having multiple different meanings in certain things, right? Rather than isolating yourself or being judgmental when you feel threatened or bothered by something different, it's okay to ask the patient, hey, what do you think is wrong? What do you think caused your problem? How do you cope with your condition? And you will probably get really different responses depending on what culture you come into contact with them, depending on what illness you're coming in contact with. But also being so here's some of the questions again. What do you think is wrong? What do you think caused your problem? How do you cope with your condition? But you also have to be self-aware. So it's okay to be uncomfortable when you're dealing with people from other cultures, but ask yourself, what are you feeling? Why are you uncomfortable? What are you afraid of? Right? Are your feelings rational, or is it just you're just uncomfortable because it's something different? And what are your options? How can you kind of maybe reapproach the situation? Okay. And so I think so many people are uncomfortable because it's something that we've never considered, or we're so likely to think that the way we view the world is right, when really other people have been viewing it a different way for a lot longer than we have. And so we'll talk about this when it comes to Eastern and Western medicine. So, for example, like there was a good example of a bunch of providers dealing with a Cambodian family in whatever medical situation. And so, I think one of the Cambodian patients was getting ready to get surgery, and the staff wanted to cut off the silk threads that encircled this patient's wrist, and this was definitely not acceptable from this patient. Like, it was these silk threads were tied by a holy person as a way to kind of tie in their soul before the surgery, similar to the Hmong example that we talked about with Grey's Anatomy. So to cut these threads would make a person vulnerable and to invite bad luck. What about Sikh people? Sikh, not supposed to cut or shave your hair, which is considered a gift from God. But if this person needs to have brain surgery or surgery around the head area, you're not supposed to, you're supposed to shave surgical sites so that you reduce the risk of infection. But what do you do when this patient, doesn't want to cut their hair? There's actually a rule about not cutting their hair. So the provider needs to come to some sort of compromise, so we can maybe only shave a small area with the patient's permission, something like that. So there's actually different levels of or dimensions or levels of influence on culture and health communication. And it's important to remember that culture is not just a difference between people's nationality or people's ethnicity. There's also differences in terms of individual culture. So remember in Maria's story, she was very careful about what she said or did when she went to the doctor. She didn't want to tell the doctor that she studied health communication. She studied human behavior through an academic lens because she was afraid that it would make the provider uncomfortable. And so we've talked a lot this semester too about how the provider comes from a completely different culture when they go to med school, and patients have completely different experiences as patients. And so the voice of the life world and the voice of medicine, two different cultures in some ways. Informal groups, family and friends. Okay, these are examples of different cultures that we belong to, but also caregivers or different family communication types and patterns within different families, or if you belong to a different illness group. So if you're a diabetic, you're gonna be in the culture of diabetics. Or we talked a little bit in class today about how athletes have their own cultural approach to health. Okay, and then organizations. Healthcare organizations, religious groups, political groups. Remember the religiously run hospitals in town. So St. Joe's. How they serve people who can't pay for healthcare, or what types of procedures they do, or what types of services they provide, are a lot of times going to be dictated by their culture. So some of these religious hospitals might not provide birth control or perform abortion services, those kind of things. And then communities. So the group of people in the community, maybe they aren't getting the information they need. So, for example, like poor people tend to rely on TV as opposed to the internet. And so making sure that when you're reaching out to a certain community, you give them culturally appropriate information. Okay. And so the flow of information within the community can relate to its own culture as well. And then, of course, nations or regions. So what's interesting is that we see a lot of health disparities. We've talked a lot about how there's a ton of health disparities within the United States, but there are even bigger health disparities between the United States as a whole and other countries, especially more third world countries, poorer countries that don't have healthcare services as much as we do. But again, with ethnicity too, Ethnicity means race plus nationality, which also deals with your ancestry, so the shared group history, language, and beliefs, your upbringing, right? So the unique sociocultural characteristics of the group that you belong to. So, for example, uh, people who adhere to Muslim backgrounds have different diets, different cultures, depending on their denomination, right? The relationship to the overall society is also dictated by your ethnicity as well, or your religion, which is also a product of your ethnicity in some cases. Okay, and then how competent are you in dealing with other people's cultures and interacting with other people's cultures? And so cultural competence means having effective behaviors, attitudes, and policies in situations within a system, organization, or among professionals where different cultures are interacting. Okay, so one of the biggest gaps in the world, the biggest cultural gaps in the world, is between Eastern and Western cultures. It's for some reason especially challenging for people in these cultures to understand one another. And our approaches to health are very, very different here in the West compared to in the East. So, East meaning parts of the Middle East and Asia, West meaning parts of Europe and the United States and North America and South America, right? And so, in the West, we tend to think of illness as an attack by an outside force, right? And people have to fight for their lives. So our bodies are invaded by outside forces, by bacteria and viruses and allergens and rogue cancer cells. And so in order to cope with it, our body has to do battle. We are constantly on the verge of war or disaster. Think about how we call different illnesses: heart attack, asthma attack, risk factor, warning sign, right? We're constantly vigilant. We're watching for warning signs and we're ready to engage in combat. We're fighting disease, right? And then we've already talked a lot about how people who are sick should be strong and real fighters. If you die, you lose your battle. So that's our kind of our approach to illness. Sickness is an attack. People have to fight for their lives. But the way we approach medicine is very different as well. We revere science. Medicine is ready to come to the body's defense. And the medical world is unquestioned. It's beyond criticism because we rely so much on evidence-based medicine, right? So we make treatment decisions based on the results of scientific studies. And just like these, our bodies are invaded by outside forces when we get sick. We also cure the body from outside the body, right? We cure the body by putting things into the body from without. Okay, so this is called an organic perspective, which means that we assume that health can be understood in terms of the presence or absence of physical indicators, right? So if medical professionals are careful and vigilant enough, they can probably minimize or get rid of most illnesses, right? But at the same time, this also kind of excludes social and spiritual and psychological factors. And we kind of consider these not relevant to illness, even though they should be. It also can't account for illnesses that can't be physically verified. So things like chronic fatigue syndrome or mental illness, things that are hard to biologically prove that exist, we struggle to diagnose these. We struggle to deal with these. And so in the West, curing doesn't really mean healing or restoration of wholeness, restoring a person back totally to health, right? Which is really interesting. So sometimes we have to hurt people in order to make them better. Remember our discussion about sickness and health at the very beginning of the semester, where sickness is not necessarily like the absence of all all ailments, right? You could still be sick even though you're not sick. So think basically Western medicine is just about getting rid of the original ailment. So think about chemo, right? The goal there is to get rid of cancer, even though we're kind of destroying the body in other ways as we go. And so biomedicine in the West, Western medicine isn't wrong or false at all, but the trap we fall into is that it's the only perspective on health. And it's a cultural assumption. It's in the West, we kind of think of it as the end all be all, but it's not really a universal truth. It has limitations. It's really helpful though. It saves so many lives, but it's not the only way. And so the East approach to medicine has been around much longer than ours, much longer than the West. So basically it deals with health from within, whereas the Western medicine is cure from without and invaded by illnesses from without. The East is health from within. So we're dealing more with a harmony perspective. Illness is not simply the absence of physical signs of disease. So we might think people who practice Eastern medicine are like deluded or uneducated. But like I said, it's been around since like 2000 BC, probably before then, right? So and it's worked for a lot of people. We don't really know why it works, but it works. So Eastern medicine, people want to seek a sense of harmony and peace and balance and flexibility. That is the healthiest approach. We're not hypervigilant. We're not in attack mode. We're working more on having harmony in your relationships, harmony on a spiritual level, making sure you maintain the physical strength, being in harmony with the environment, dealing with kind of these energy fields within and around your body. And so really we're focused on overall well-being. And when you're sick, it's a result of an imbalance. So people who live more balanced lives are more likely to remain well, even if they're exposed to things that would make an imbalanced person sick. And so they don't deny the existence of germs. They just think people are more susceptible if they're off balance. And so in the Eastern philosophy, the mind, the body, and the soul are not separate. One affects the other. So you can think about these Hispanic concepts, even though technically it's in the Western hemisphere. A lot of Hispanic approaches to illness are Eastern. They're pretty similar to Eastern philosophy. So Hispanic concepts of susto and coraje, which basically say that these, like if we experience an emotionally intense and unpleasant episode, they can result in traumatic experiences that can diminish a person's spirit and disrupt the connection between their body and soul. So coraje, for example, a majority of Mexican American immigrants felt that their diabetes was at least partially caused by coraje, which means anger, like an anger incident. Many Mexican American immigrants attributed their diabetes to anger. Susto is this conviction that a shocking, unpleasant, or frightening experience can cause physical illness. And in Mexico, they believe that a person's spirit can become detached from the body after a frightening experience, which would result in someone being listless and restless and indifferent to food and hygiene. And which sounds a lot like, well, you just have a lot of stress, or you have depression, or you have PTSD. But other people argue if you pay close attention to what susto really means, you would see how it's really different from anything found in biomedicine. It's not PTSD, it's not depression, it's not stress. And so this is an example of how language kind of reflects culture in a way, and illness reflects culture. In the same way that, in Alaska we have thousands of words for salmon, where in, most of the continental US we just say that that's salmon, right? But it's very important to people in Alaska, so they have different words for it. And so this energy, like I mentioned, can affect a person's health. So a traditional Hindu individual from India might believe that accidents are caused by karma, which is attributed to good or bad deeds that are done in the past. But traditional Chinese medicine, which, like I said, has been around since 1766 BC, believes in the yin and the yang, which are these, those, you've seen obviously the symbol, but the polar energies whose cyclical forces define all living things. So the yin represents coolness and reflection, the yang represents brightness and warmth, and also pretty common in traditional Chinese medicine is qi, which is spelled Qi, which is the central life energy, which means that illness and death might result if your qi is wasted, or if the yin and the yang aren't balanced. And again, these sounds crazy, and it's really hard to grasp because it's invisible. It's something that's sensed rather than measured or directly observed. And so people who actually practice traditional Chinese medicine, they're trained from the time they're like little kids. They don't even realize that they're being trained. They're like kind of brought into this group, and they're put through training, which feels like games, but really they're kind of being trained to be a traditional Chinese medicine healer from the time they're young. But once these people practice for a long enough time, they can know what's wrong with the person just by sensing the person's qi visually or through touch. So all last year I did a fellowship at U of M hospital, U of M hospital that focuses on integrative healthcare, so complementary alternative approaches to health. And so we talked to a lot of different integrative or complementary or alternative providers. And we talked to Dr. Liu, who was a traditional Chinese healer, and he told a story about how, or actually someone told the story about him. They went to see him, and basically you go in and you sit down and he looks at you for like 5 minutes. You're not supposed to talk or do anything. He asks you to stick out your tongue. He looks at your tongue. He smells you, which sounds weird. But all he said to this patient was, "You won't get better until you get rid of him." And this patient had been like going through a really bad breakup, and like this guy was not like was like stalking her, and she couldn't break up with him. It was a really bad situation, and he nailed it without even her saying a word. And so it's a really hard thing to explain. It's really interesting. But here's kind of what traditional Chinese medicine looks like. And on the right, you could see kind of how health is the reflection of energy that flows within the body and between the body and your physical environment. And so, we are best when our energy is balanced and our flow is uninterrupted. So, like, a lot of people get what's the word I'm looking for? A lot of people get what's the word I'm looking for? When you stick the needles in the person. Oh my gosh. A lot of people get that treatment. You guys are screaming at the computer right now. A lot of people get that treatment when to alleviate some of the energy flows or blockages in your body. So when you get the needle stuck into you, it's supposed to help things move through your body faster, right? It helps your energy be balanced and your flow uninterrupted. And so these practitioners look for energy deficiencies, excesses, obstructions. The example on the left is the 5 elements of traditional Chinese medicine, which is wood, fire, earth, metal, water. We're all connected to the earth in different ways. And so if you're sick with a particular illness, you either have too much wind or not enough blood or whatever. It just basically means you're tired or you're dull or you're out of sorts. So these treatments are like a lot more mild and designed to enhance the body's natural functioning. So compare these to chemo. Okay. And obviously the word I was looking for is freaking acupuncture. Gah! Annoys me. All right. But so surgery and strong drugs, Eastern medicine believes that these things interfere with the body's natural rhythms. And so they try to do things that heal the body from within. We're trying to treat the body from within rather than put in outside things to make the body better. Right? We're trying to, we believe that if the body's in balance, that we treat certain things within the body, that the body will take care of itself. So that's why we do things like acupuncture and self-massage. And we're trying to restore that life energy, sustain it, balance it by helping a person be aware, maybe do some rhythmic breathing, physical regimens, meditation, those kind of things, right? So definitely not an absolute dichotomy between East versus West, right? Eastern countries still have really high-tech medical centers, and a bunch of people in the West. If you go to Ann Arbor, you'll find this everywhere. But a lot of people will use massage or meditation or yoga. So the joke is like, you bring your shaman and we'll bring our surgeon and we'll see if we can work on this problem together. And so the goal here is not to say that one is better than the other, but to integrate these as much as possible to give a person the most options that they can get, right? And so it's really important to know the differences between East versus West, because really well-meaning people can still kind of trip over some of these cultural gaps, sometimes with really harmful consequences. And so my mom had a patient from an African country who requested a Spanish translator. So he spoke Spanish, but he's from an African country, and the doctor thought it was so weird that he almost didn't order one for the patient, just because of his kind of conceptions of culture, right? Even though that wasn't right. So I kind of want to quickly highlight a couple different cultures really fast. The first one you've heard me talk about a little bit was Appalachian Kentucky, which if you can see in the lower left, the kind of map there, which is a lot of central and eastern Kentucky, the Appalachian region, which divided a lot by hills, and so pretty isolated by those mountains. And so as a result, they're really proud and private. They were kind of shunted off from the world for a long time until people started going there more because roads were built and stuff, and they started leaving that area. But for a long time, we're totally self-reliant and totally proud and totally private. And as a result, they don't really accept charity very well. And so at UK, when we tried to do research out there, it was really hard because they thought we were coming from the big city of Lexington and wearing our white coats, and here are the people coming in here and telling us what to do, and without us really understanding their culture. And so there's a lot of skepticism there. But University of Kentucky, after a lot of efforts, really learned a lot about, for example, like HPV and cancer prevention, because HPV is a huge problem in Eastern Kentucky for a number of different reasons. Probably because there's such a religious approach, and people don't want their teenage kids to have sex, and so thinking about Gardasil or something is out of the question, right? But as a result, we get poor information about cancer screening and treatment there, especially colorectal cancer screening and breast cancer. And so as a result, these people really rely on their informal networks, their friends, their family. If it worked for them, it's good enough for us. But we talked about Mountain Dew mouth there. Tobacco use is really high because so much of the economy in Kentucky was a product of tobacco, right? There's not very much in terms of medical services available, and you can only be 20 miles from the closest clinic, but because of the mountains and stuff, you have to drive around them. You can't drive through them, and so that 20 miles might take 3 hours to get to the place you're trying to get to. Environmental risks like mudslides, like pollution and stuff, but basically the people there are very poor and very uneducated. And so I want you guys to think of, are there any unique communities in Michigan like that? Like I think maybe hookah and young adult Arab Americans in Dearborn would be really interesting, and kind of figuring out what the deal with that is. But yeah, in Eastern Kentucky, it was really interesting because it took a lot for us to kind of build a barrier there, or build bridges there, and a lot of it was trying to empower the people who actually live there and not come in and tell them that this is how you have to act. Right. We talked a little bit about the Hmong people, which are it would be classified as Asian and Pacific Island people. Typically, the Hmong come from China and Laos and Thailand. And so we saw in that Grey's Anatomy clip a very collectivistic culture where, the family hierarchy is so important. It's so much more important than the individual. And so we also see an aspect of spirituality where we got shamanism and a connection to past ancestors. And so the spirit and the body are linked, and there's a very delicate balance between the two. And so in 1997, you can see the book on the right, Ann Fadiman's The Spirit Catches You and You Fall Down. She's a journalist in California, and she found out about this Hmong refugee family in California. And the daughter of the family had really severe epilepsy, and the family viewed these seizures as a spiritual encounter. And they viewed them as a positive thing, right? She has contact with the divine. She's been chosen. This is before that they even found out that their daughter had epilepsy, but they called these kind of seizure spells, the spirit catches you and you fall down. So these were considered a good thing among this family. But the seizures started to get so intense that she got hurt. She fell and got hurt. And so once they started to interact with the American healthcare system, though, it all fell apart. So they didn't speak the same language. We don't talk about health in the same way. In the Western perspective, epilepsy is not a good thing, right? It's something we need to fix and not integrate into our lives. And so social services were brought in because they didn't think the daughter was being taken care of. And so basically, like, the healthcare providers saw these people come in. They grabbed the Chinese and the Korean interpreters, just kind of based on sight because they looked Asian. And they couldn't provide it for them because they didn't have a Hmong interpreter. So there was a significant breakdown in communication because of cultural dissonance, where we're not seeing any attempt, unlike the Grey's Anatomy example that we watched, any attempt to compromise. The Hmong people understood epilepsy in their culture, but just not in a medical health literacy way. So they understood it, but just because they didn't understand it the same way we do doesn't mean that they're wrong necessarily, right? So we watched the Grey's Anatomy example to see how that family structure functions and how different cultural beliefs about health can take roots, and how doctors need to have cultural competence. And then very quickly, Hispanic or Latino communities. Basically, really important, respect for people of greater age and social status. Family and friends are super important in coping with hardship. Very tight-knit groups. Important sources of support, closely involved in making care decisions, so it's not just the patient's decision a lot of times. And religion is likely to be a source of really great value and comfort. But on the other side, it might lead people to feel that their health screenings and other things are unnecessary because everything's in God's hands, right? So that's called fatalism, which we talked about, I think, in chapter 8, where everything's in God's hands. It's out of our control. Don't worry about it. God's got it, right? So in chapter 13, we'll talk about the tamale lesson, which was what's called community-based research that came out of the University of Southern California. So we know that Latina women are more likely to be diagnosed with stage 4 breast cancer than white women. So we talked a lot in chapter 6 about disparities. So how do we go about improving this disparity on a cultural level? So Northwestern School of Medicine, which is in Chicago, has done a lot to promote breast cancer screening among Latinas. And we did similar things in Eastern Kentucky. So what they did first, before just coming in and saying, hey, you dummies, you need to get a mammogram earlier, they conducted focus groups with members of this community, of this culture, to learn about the reasons why they are not getting breast cancer screening earlier. We did the same stuff with Eastern Kentucky and HPV. Then they created Spanish and English videos that address these barriers. So if you have these people saying, well, I don't want to get a mammogram because I'm afraid it's going to hurt, or the machine's going to malfunction and it's going to smash my breast, which is a legitimate concern from some people. You make videos that address these barriers. So as a result, people in this community came out with increased knowledge and more positive attitudes after the intervention. And so basically what they did here was they worked with and served with partners in the communities to determine what the agenda was going to be and what the purpose for research was going to be. Again, they didn't just kind of come in here as academic researchers or policymakers and say, okay, this is what would be best for you, dumb people, or what would be most relevant for you people. They worked together with community members to determine what the topic would be and what the purpose for the research would be. Okay, so we'll talk about that again in chapter 13. All right, so before we jump into this, I want you to think about how much control do you think the doctor should give up to adapt to a patient's cultural beliefs? So we see things like Christian Scientists, which don't believe in any medicine, or Jehovah's Witnesses. And so I think we had I think Madeline had a really good description today of when it's okay, or what providers should do when their goals are so different than a patient's goals. And so it just depends on if they're compromising their duties as a doctor. How different are the procedures? And so Madeline had a really good point to say, fill in the patient about what they're going to be missing out on. It's your job to educate, but you can't make them do anything, right? So saying, listen, if you don't get this blood transfusion, you're going to die. It's the patient's responsibility the provider's responsibility to explain the procedure and the consequences if it doesn't happen. It's maybe finding a compromise or an alternate route if possible, but in other cases, if you can't, then that's the patient's decision. So we go to the doctor because we can't cure ourselves, and so maybe patients need to give up a little bit of their control. But again, the example of an athlete from the culture of athletics, right? The athlete needs surgery, but they can't miss the rest of the season. Is there something else they can do as a quick fix? What should the doctor do? Say, this is my medical opinion, rehabbing and taking 2 months off and being uncertain if it's going to be better, or getting surgery and taking 4 months off with certainty that it's going to be better. But, maybe the patient doesn't want to miss that much of their sport. So, anything the doctor can do is basically just fill the patient in as much as they can. All right, and then last thing, really quickly, I want to talk about holistic medicine, which was once seen as quackery, but has really gained popularity in recent years. And so actually 4 in 10 people in the United States have tried some form of holistic medicine, whereas 80% or 8 in 10 people have worldwide. And so holistic medicine would be considered like acupuncture, there's that word that I was looking for earlier, chiropractic medicine, herbal therapies, homeopathic medicine, osteopathic medicine, Reiki, relaxation therapy. And one of the reasons is it's popular here is that it's really inexpensive and it's geared toward prevention and long-term health maintenance, right? Whereas in Western medicine, it's find it and attack it, okay, even if it destroys other parts of your body. Think about surgery, right? We're taking things out to fix one thing, whereas holistic care helps the body heal on its own. So basically, it focuses on lifestyle changes and natural remedies, and a lot of times the focus tends to be on open communication. It tends to be really a lot more biopsychosocial. And so some people seek holistic care when they're not really satisfied with the results or the nature of biomedicine. And so a lot of people use holistic medicine in addition to Western medicine. So like people continue to see physicians and other practitioners as well, but they'll get things on the side. Okay. So here's the deal. We don't really like the term holistic medicine. It's okay. We really don't like the term alternative or complementary. So alternative medicine is not the correct term because these forms of treatment should not be considered as an either or, right? It's not like, okay, so Western medicine didn't work for you, let's try this instead, right? What is actually used is in conjunction with Western medicine, with other treatments, right? So you're getting chemo, which is a Western form of treatment, but also you could be practicing meditation, prayer, and yoga to kind of promote emotional well-being during that treatment. So it's not used by itself as an alternative. It's used together with the other form of treatment. Okay. Part of the problem with alternative and culinary medicine is that it's really hard to scientifically research them and approve them by professional or associations like the American Medical Association, because they've been around for thousands of years, and frankly, we don't really know why they work. Okay. Yeah. So the same way we don't really know how aspirin works, but we just happen to invent it on accident. Right. So we're really skeptical of alternative and complementary medicines because we don't know how to explain what's going on. Right. Complementary is a term we don't really like either because it means it's peripheral in relation to biomedicine. So it's used in addition to you know conventional medicine. It's something that goes alongside of it. But we use holistic more because it emphasizes the whole person. Okay, or integrative because we try to weave these two together. So think about if you've ever taken a part in holistic treatment, and like taking medical marijuana would certainly count here. Did you tell your doctor about it? Yeah, a lot of people are afraid to because they're afraid how their providers are going to respond. But yeah, like for example, I think I told the story about one of my cancer patients who his chemo nurse suggested that he smoke pot because the nausea medicines were ruining his quality of life, causing him to sleep all day. He didn't eat at all, and then he smoked pot, and he had a great quality of life. Helped with his nausea and helped him live. So yeah, we're seeing a lot more providers being trained in holistic medicine, a lot more money allocated from research to study this more, and we're starting to see more health plans and biomedical practitioners cover it and provide it. And so I don't know if this is true still, but a couple years ago, Medicare and workers' comp plans in all 50 states could reimburse chiropractic care. Chiropractic care has usually been one of the most accepted holistic forms of medicine. So quickly, advantages. It's a good thing to do in addition to traditional medicine when traditional medicine isn't working on its own. It doesn't cost a lot, doesn't take a lot of technology, and of course we could stand to reduce healthcare costs as a country. For a lot of patients, it's really simple. It's really understandable. It's not as frightening. Patients feel like they can manage their holistic care better than just focusing on the one thing that's ailing them, right? And holistic practitioners, like I said, want to spend more time with patients. They develop closer relationships because the focus is more biopsychosocial. My mom went to one for high cholesterol, and she would be in there for like an hour. But it's usually more directed to health maintenance and prevention than biomedicine, which is good. Biomedicine, again, emphasizes curing and treating as opposed to prevention. So disadvantages, like I said, some products are not well researched because before they go on the market, the therapies haven't really been scientifically researched and approved by the American Medical Association or the U.S. Dietetics Association. So you really do have to be careful to see what can interact. So like herbs and natural products can be harmful. Remember ephedra, which was something that people took as an energy supplement for athletic performance. It was linked to at least 17 deaths. And also, you could really easily be tricked into buying useless products like shark cartilage, which is supposed to diminish cancer, but there's no evidence whatsoever. And like I said, it's really hard to study. We're getting really gradual and really ambiguous results that are pretty difficult to measure. And if you have cancer and broken bones, you're probably going to go traditional. Like you probably should go Western medicine, and maybe use integrative medicine in addition to that. But you like I said, you might also not be inclined to tell your doctors about it because a lot of people are dismissive or really critical of holistic therapies, which can lead to some dangerous drug interactions if they prescribe you something that would not go well with it. Okay, so that's it. Let me know if you have any questions. Talk to you later.